The framework has given us, I suppose, a structure to look at our practice and to stimulate thinking in relation to and create awareness among staff. And I think before, although it was always something in the back of our minds, I think now it's at the forefront of our minds when we get a patient in.
But what it's also been able to do for us in mental health is see that whilst we do things really well, we've been able to learn from different projects and different community services also external to Monash Health.
Because our framework and structure is really closely married to the National Quality and Safety Health Service Standard, the framework just fitted really well with what we already do, so it was an easy framework to adapt.
We think the project is quite important to the service. It allows us to reflect and evaluate the service that we provide to mental health consumers.
I think it's really opened our eyes. It's given us a measurement tool, almost a benchmark of how our service sits right now, what we think we're doing, and it's enabled us to say, actually, do we have evidence to prove that we're able to do this? And if not, then that gives us a goal then to work towards.
Really eye-opening to be involved in the framework. It's been actually a real honour to be involved in the project, and also just to see the cultural diversity that we have within our team.
It's going to build knowledge for staff to better resource clients and their families, responsiveness of staff in relation to the different cultures that we have and the different cultural needs and norms.
Working through the organisational cultural responsiveness scale, it has assisted us to identify gaps in service and develop an action plan that we can work with as a service but also individually as clinicians on the inpatient ward.
MIMA, Mental Health and Multicultural Australia, is funded by the Commonwealth Government, and it basically brings together experts working in the field of multicultural mental health, transcultural mental health, and university academics together as a consortium. We very much work in line with the national reform agenda in mental health to ensure that they are culturally inclusive and culturally responsive to the needs of the immigrant and refugee population in Australia. And essentially the idea behind the framework is very simple. It's really about having access to online tools that assist mental health services to self-assess and look at what they are currently doing in terms of how they provide mental health services to a culturally diverse population within their catchment area. And then it's to really determine what their priorities are that need improvement.
So all the services had to undertake this organisational assessment, and after they complete the organisational assessment, they got an overall score. This assessment was across 8 cultural competencies. This score was really to guide the organisation in order for them to implement and really develop an action plan to improve the services for consumers from CALD backgrounds.
And once organisations go through the self-assessment, they then can go on to the second part of the framework, which consists of implementation guides. And we have an implementation guide for organisations and one for workers. And the implementation guide consists of strategies that organisations can implement as part of an action plan within their organisation. The third part of the framework consists of a range of additional supporting resources. So we have some concept sheets about some sort of key topics that are very common in multicultural health, like what is culturally responsive mental health practice. It explores the issue of recovery in mental health from diverse cultural perspectives. It looks at issues of consumer and carer participation from sort of a multicultural perspective. And they are sort of very much the underpinning principles of the framework. But then what we've also done is that we've highlighted examples of work that's already happening around the country. So for instance, if an organisation is wanting to do a specific piece of work, say around say consumer and carer participation, we've actually got examples web-linked to that work already happening around the country. So organisations don't have to reinvent the wheel.
Look, the framework not only does it collect data, and data is an important essence of improving services, and finding out what has helped, what has not helped, and what we can change, and what the gaps are, and what challenges are, and we can work on those issues. we can encourage what's been more helpful for others to gain benefit too. The other thing I wanted to say that the framework does, it bridges the divides among people, and that's an important area of work. It also allows networking and dialogue to flourish throughout the services on this particular topic of multicultural mental health agenda.
The working groups were actually involved in the design of the MEMA framework tool. So from its very inception, that's very important in terms of consumer and carer participation and giving people a voice. From the feedback that we've had from consumers and carers who've been involved in the pilot sites, it's been very empowering for consumers and carers to participate. We talk about stigma and barriers for people trying to utilise services, but there are actually barriers within services to people accessing those services, and some of that is around staff being culturally aware. And I think that this tool can help services to become more capable in the future of providing services and continuity of care to people from multicultural backgrounds. Often in services, people don't have the time to actually go out and undertake training outside of the workplace. And so this tool actually enables them to be able to utilise the framework within the workplace and see the results on a daily basis and as they're actually engaging with people. So that has to have positive benefits in the future for people with multicultural backgrounds.
I think next steps or next iteration of this really are about upscaling the adoption of the framework across every possible setting, whether it be acute care, community care, in terms of mental health. I think that's a real opportunity that we've got going forward in the future. I think the other opportunity that we've got going forward in the future is to develop more bespoke education and training that guides people, I guess, through some of the practical processes they can go through or put in their organisations to strengthen, build on and improve cultural responsiveness. I think also from the point of view of organisations that are commissioning or purchasing the delivery of mental health services and really wanting good outcomes in terms of frontline care, the framework really has the potential to be a quality assurance or benchmarking tool as a safeguarding mechanism, if you like, that puts services on a path of continuous improvement. And that's ultimately what we want. Philosophically, the framework really is about making sure that every Australian who needs access to mental health services gets them in the way that they need, in the way that's culturally appropriate. And a tool that really gets services to think about that really is the way of the future.